Right, hello everyone. We'll go ahead and get started as everyone's coming in. Thanks so much for joining us. The Southeast Mental Health Technology Transfer Center is pleased to present today's webinar event, Understanding and Addressing Human Trafficking in Your Work. My name is Emily Moore and I will be moderating today's event, but before beginning, I would like to take a moment to describe the work of our center, address a few housekeeping items, and introduce today's speaker. Please note that our work is funded by a grant from the Substance Abuse and Mental Health Services Administration, or SAMHSA. And also, please note that our center and that the larger MHTTC network use affirming, respectful, and recovery-oriented language in all of our activities. We do invite you to use the same person-centered language when posting and discussing in the chat. The Southeast Mental Health Technology Transfer Center is located in Atlanta, Georgia at Emory's Rollins School of Public Health. We are proud to serve the 8 states in HHS Region 4. Our expertise in public health programs, systems, research, and evaluation provides a unique lens through which we can address mental health priorities. The goal of the Southeast MHTTC is to accelerate the adoption of evidence-based mental health programs by providing trainings and technical assistance throughout Region 4. We use a public health approach to build leadership capacity and to provide mental health trainings and resources to providers, agencies, and communities across the Southeast. We do encourage you to visit the Southeast MHTTC website, mhttcnetwork.org/southeast, to learn more about our center and upcoming events like this one. Please note that this event is being recorded and will be posted to our website for on-demand viewing, typically in about 3 days. We encourage you to share your thoughts in the chat feature at the bottom of your screen. Please remember to select Chat with all attendees to share your comments with everyone in attendance. We will devote time at the end of our presentation for question and answers. Please submit your questions during that time using the Q&A feature at the bottom of your screen. We've also allotted time at the end of this event for our SAMHSA required evaluation surveys. We will share a link in the chat, or you can wait to be redirected to the surveys after the webinar has ended. For those attendees who are interested, you may download a certificate of attendance upon completion of evaluation surveys if you need that for your records. And also, if you have any questions after the event, please contact us at info@southeastmhttc.org. I'm going to go ahead and introduce today's presenter before I hand it over to her. Bethany Gillow is a national consultant on anti-human trafficking initiatives, from training and program development to state and federal policy. Bethany has over a decade of experience working in the anti-trafficking field, both domestically and internationally. Prior to consulting, she served as the statewide Human Trafficking Prevention Director for both Florida's state child welfare and juvenile justice agencies. In these roles, she worked to strengthen systems of care for youth and families impacted by trafficking. She implemented federal and state legislation, created agency policy, and oversaw all state-level efforts to identify and serve survivors of sex and labor trafficking. In addition to public service, Bethany has worked within direct service organizations serving sex trafficking survivors in Florida and India. She has also served as an adjunct professor at Florida State University and co-authored multiple resources for the anti-trafficking field. Bethany currently sits on 3 national advisory groups and chairs the National Child Welfare Anti-Trafficking Collaborative. Thank you so much for being here today, Bethany. I'm going to go ahead and turn it over to you for today's presentation.
Great, thanks, Emily, and thank you to the TTC for the opportunity to recognize January as Human Trafficking Awareness Month and have the opportunity to speak with you all on human trafficking. As they noted, my name is Bethany Gillow and I'm a national consultant. I'm really excited to be here and speak with you all today and to just go through some foundational information on human trafficking. You may see, I have a little one here with me, so you may see some movement or rocking or shaking. So thank you for your kind of going along with the flow of working from home on that. So we're going to try to get through a handful of things today to help us get a kind of groundwork understanding of human trafficking. We're going to define and understand human trafficking, discuss strategies for identification and reporting suspected human trafficking cases. We're going to briefly talk about a project that supports integration and highlight some of the exciting work that's being done within SAMHSA, and then provide resources for additional learning so that you can further dig in and understand how you as mental health providers can really engage on this topic, engage on the work being done to address trafficking, and really be able to not just identify and report, but also maybe meet the short and long-term needs of persons who have experienced trafficking. So we're going to start off with a quick poll to see how much, if you all have received training on human trafficking before. And so there's yes, no, and yes, but I could use a refresher, and that poll will pop up in just a minute. Here you go. Just a quick poll so I can get a kind of understanding of where folks might be in terms of their understanding of trafficking, and how much time we'll devote to the kind of initial definitional information. So you should see the poll up on your screen. Just a yes, no, or yes, but I could use a refresher. It is a really complex topic. It intersects with many other complex topics. And so I think it's, if anybody who has worked within or around efforts to address trafficking knows that it is a constantly evolving field. Okay, great. A very mixed bag. It's almost 1/3 each for yes, no, and yes, but I could use a refresher. So we will definitely make sure we take the time to get into some of the nuances of the foundational information to ensure that everybody does have an understanding of what trafficking is, how it differs from other types of victimization, and how we can learn to identify it. Thank you for participating in that. I'm also going to be throughout asking a couple of questions. I noticed folks were populating where they are. I love that. I would also love if you could just pop into the chat kind of what area of work that you work in. I know some people put the agencies that they are working in, it looked like. But where are you working? What kind of services are you working in? I see counseling services, forced marriage initiative project at a justice center. Would love to see kind of what areas you all are working in. Medical clinic, great. Street crisis response team, peer supervisor, chemical dependency counseling, FQHC, great. Oh, wonderful. We got a really diverse group of folks. A victim advocate, that was my first role. So that is wonderful. That is some hard and rewarding work in victim advocacy. School social work, wonderful. I'm actually giving a school specific resource there at the end. So that'll be something that you all can look at. Great, awesome. Thank you for sharing that. We'll be asking a couple other questions. So I'm liking this level of engagement. Thank you everybody for populating those responses. All right, so we're going to start with definitions. Normally, I try not to just read from the screen, but I want to make sure that we walk through the very specifics of these definitions because it's those nuanced elements that do distinguish it from other crimes such as smuggling, wage theft, labor exploitation, kind of other things that are close or often misinterpreted as trafficking, but are not themselves trafficking. So labor trafficking and sex trafficking, these definitions are from the Trafficking Victims Protection Act of 2000 and updated through the Justice for Victims of Trafficking Act of 2015. And so these definitions are coming from US federal law. Of course, states have their own definitions. But it's the recruitment, harboring, transportation, provision, or obtaining of a person. So any one of those things for labor or services through the use of force, fraud, or coercion for the purpose of subjugation to involuntary servitude, peonage, debt bondage, or slavery. The sex trafficking definition is very similar with your action words, although it adds patronizing, soliciting, and advertising, which means that persons who are purchasing commercial sex can be charged with trafficking. It's obviously a rare situation and typically involving aggravated circumstances, but those words were added in 2015 to try to hold accountable places that were advertising, patronizing, or soliciting as well. for the purpose of commercial sex, in which the commercial sex is induced by force, fraud, or coercion, or in which the person, the act being induced is under 18, or the person being forced to perform commercial sex is under 18. So that's a really important distinction. Children under the age of 18 who are engaged in commercial sex are automatically considered victims of human trafficking with no requirement for force, fraud, or coercion to be present. So the elements that make trafficking distinct from some of these other crimes, I just have this great visual that I think is really helpful. The action, means, and purpose. Anybody who's seen a trafficking training before may have seen the AMP model, but it really breaks it down into, these are the actions. Any one of these, recruitment, harboring, etc., can create a situation where a person can be charged with trafficking. The means are the element that distinguish it from other types of exploitation and abuse. So the force, fraud, or coercion, those are your key elements that have to be proven in court for it to be actual human trafficking, and then your purposes. And so I try to highlight this because there is a lot of misinformation and misunderstanding that swirls around about human trafficking. It is one of just those hot topics that gets kind of picked up and taken anywhere. So I think this helps make it really clear. Somebody could be transported across lines for the purposes of engaging in work, and may even have a debt to a smuggler. But if they're willingly choosing to kind of be transported and are aware of that debt, and there's no force, fraud, or coercion or kind of exploitation that comes out of that, then, or forced exploitation that comes out of that, then it's smuggling if it's crossing international lines versus trafficking. So we're going to do another quick chat activity, because I always love to hear kind of what folks know about trafficking. So what are the first things that come to mind when you hear the term human trafficking or sex trafficking or labor trafficking? Y'all can populate some of the, children, kids. Yeah. Child sex or labor. Forced prostitution. Vulnerable people. Absolutely. Yeah. Use of force. Yeah. These are great answers. Some of them very in alignment with kind of what is most commonly covered in terms of media coverage of trafficking situations. Grooming, yeah, absolutely. Yeah, great. So in looking at some of the images on this screen, working in the field of trafficking, they make my skin crawl a little bit, but these are, if you just kind of randomly image search human trafficking, these are some of the most common images you'll see. The face over the mouth, ropes, handcuffs, the barcode, for whatever reason, is another really common thing you'll see. Overly sexualized imagery, almost always female, almost always a young female being shown in the situation, almost always a young white or white appearing female is what you will pretty much always see, or most often see, when you image search trafficking. So this is what kind of is most known and perceived by folks who, when they hear the term human trafficking, because this is what imagery is put out there. So that it's always kind of forced, that it's always young girls, that it's folks that look like they would most definitely want to be rescued from whatever situation they're in, and that it's always violent. But that and you'll hear, I don't know how many of you all are familiar with some of the stories that have come across social media, but the Wayfair container conspiracy theory that came across, where people were being trafficked in Wayfair containers, zip ties on cars, people following people in Target. Everything is a situation where somebody's about to be trafficked, it feels like, these days. And it's true that, of course, any of these images, force can of course happen. It is an element of possible trafficking. They can be a young girl, obviously. It can be a very there can be sexual victimization in these cases, obviously. So all of these things can be true, but it really glosses over the fact that there are two forms of trafficking, labor and sex trafficking, that there are men and women and boys and girls and trans and intersex youth and adults that can be represented amongst trafficking victims. And in fact, there are marginalized groups tend to have increased vulnerabilities for trafficking. And so if I were to see this and I were experienced trafficking and I couldn't identify with that picture, or if I were a clinician or provider that was so used to seeing this imagery, I might not be able to kind of identify what trafficking actually looks like. If it's coercion, for example, it's hard to see coercion. It's hard to describe coercion in some situations. If it's just, it could be threats, it could be isolation, it could be removal of documents, it could be a lot of these things that won't be readily present in the forms of like bruises or physical injuries. You really do have to ask these questions. And so I just wanted to highlight this this is what's out there. This is not an accurate representation. And this is why it's so important to have really factual discussions around trafficking. And oh, there's a good point here at airports. Yeah, there's another kind of, this is not a mythology around human trafficking, but it kind of is domestic victimization erasure. We often think of like movies like Taken, where you're going somewhere else and trafficking occurs, or people are being trafficked here to the United States. That of course does happen, but many cases are cases in which it's people who live in the United States being trafficked in the United States, people who live in your community being trafficked within your community. So this is an example from the Typology of Modern Slavery from the Polaris Project, which is a national anti-trafficking organization. These are some of the venues they identified in which sex trafficking can occur. Of course, I know a lot of us think of prostitution and escort services, but also massage businesses, internet-based sex work, bars and strip clubs, pornography. There's anywhere where the kind of sexual activity has a commercial element to it is where trafficking can take place. Labor trafficking, I want to dig a little bit more into, because I do think there's not as many awareness materials and events on labor trafficking, even though we believe it's to be as big of an issue as sex trafficking, if not bigger, in terms of just scope and prevalence. Of course, they're all, very traumatizing in and of their own right. But in terms of scope and prevalence, labor trafficking is a huge issue. And it can take place in formal businesses, like hotel housekeeping, as an example. We'll look at some of the kind of the venues it can happen in, informal employment, and illegal work, which I really want to highlight because that is often overlooked as a form of labor trafficking, especially with vulnerable children and youth. And so things like illicit drug sales, forced drug selling, forced theft, of course, prostitution as well, but their forms of illegal work can be considered labor trafficking if you have those force, fraud, and coercion elements in there. So take the time to think about your community. I saw folks from all over the place in here. So what does your community or your state look like? What are some of the primary industries there? Is it a big hospitality area or tourism? Is it a big agricultural area? Lots of construction? Do you have traveling sales crews coming through your area? Take the time to kind of think of what industries are within your community. You can see here there are some highly vulnerable industries, like anything that travels, like carnivals, performing arts, the sales crews, anything that might have migrant work scenarios like farm work or construction or things along those lines where people are moving from place to work in different jobs, oil fields, things along those lines. These are all areas where there could be increased vulnerabilities or folks with increased vulnerabilities working in them and experiencing potential trafficking. And of course, again, as I mentioned, those illegal areas like illegal drug sales. So if you really take the time to kind of look within your community, understand what types of industries are more common in your community, if who would be working in those industries, what does that look like where you are, then it can give you a really good understanding of some of the things to be looking for when folks are coming, when you're coming across potential trafficking survivors, whether they're coming into your agency, you know, some things to ask around your screen in some of these service areas. So also, if you are really adept in trafficking work or kind of know it, you can also target these areas for awareness and outreach events. I apologize. So if you have agricultural areas in your city, then look at some of those agricultural areas. And give me just a minute, I'm sorry. Okay, my apologies. We'll try to keep going. Thank you for bearing with me. All right, so let's talk about what we know in terms of trafficking. We're just going to bring them up here. One of the first things we know, this is a new field, but one of the first things we know is that we don't know a lot. It's so new. When we think about the Trafficking Victims Protection Act, of course, you had older legislations like the Mann Act from the early 20th century and things that predated that. But for the Trafficking Victims Protection Act, that is the year 2000. So the modern work to address human trafficking is just over 20 years old. And so when it talks about understanding, I mean, how easy is it to understand the scope of drug trafficking or the scope of arms trafficking? You know, human trafficking is kind of in the same vein of us having kind of a shortage of understanding of what the scope really looks like. But this is one of the kind of commonly used, some of you may have seen this before if you've seen an awareness presentation. This is the National Human Trafficking Hotline. It's their thermal map that they use that shows where calls to the National Human Trafficking Hotline are originating from. And so you see some of those hotspots. You see a big one around metropolitan areas like Atlanta, like Los Angeles, Seattle, up the East Coast into New York and some of those areas. You see a lot of those really red areas around larger metropolitan areas. But this is one thing that's used to kind of give some sense of understanding, but it represents only calls that are placed to the hotline. And so this kind of in conjunction, I think a reliance on local community data is really important. Not just local trafficking data, but local data around industries and vulnerabilities is really helpful to understanding how to kind of prevent, but both recognize where trafficking might be manifesting in your area. So I want to show this because I think it is really important. As you probably heard from the bio, I have done a lot of work in child serving agencies like child welfare, juvenile justice. I worked at a child advocacy center. So a lot of I have worked with adults, but a lot of my work has been with children. But this data is coming on cases studying children who have experienced labor and sex trafficking. But it's important to know this information, even if you're working with adults, because of course, this is their history too. So we know that people who have or are experiencing trafficking often have a history of trauma and adverse childhood experiences. We know that adverse childhood experiences can be linked to chronic health issues, mental health issues and needs, substance misuse in both adolescence and adulthood. And so it's really important to understand that trafficking, of course, itself is a traumatic experience or can be a traumatic experience, but many people who are experiencing trafficking have this a long history of child abuse and neglect that are contributing to those vulnerabilities. So you can see that of the cases called in on sex trafficking, 84% had a history of child abuse and neglect, and for labor trafficking, 66% had a history of child abuse and neglect. And then in the chart on the right, you can see some of those forms of abuse and neglect that were identified: physical abuse, sexual abuse, neglect, and psychological abuse. So one of the reasons I point this out is to, again, give us a point of reference for understanding who we might ask targeted questions to or have targeted identification or prevention efforts for, but also as a reminder that it's really important to not get hung up on treating trafficking victimization alone, but meeting the holistic needs of each and every person that we are coming across and have the opportunity to serve. So I also want to talk about some of those risks and vulnerabilities. We talked briefly about adverse childhood experience and touched on child abuse and neglect as risk factors and histories that can create vulnerabilities. Of course, also prior exploitation, a prior history of trafficking. This is really a point I try to make, especially when we're talking about young adults in sex trafficking, who are being victimized in sex trafficking, because there's, criminally speaking, in a lot of states, and not every state, folks under the age of 18 will not be arrested for prostitution. But once you hit 18, it doesn't matter if any aspects of their exploitation or trafficking victimization have changed. Once you turn 18, you can be arrested for prostitution. You could be arrested for trafficking if you're involved in the recruitment part of it, under force or fraud or coercion. And it's important. There's a lot of training that goes towards the criminal justice system on how to recognize and address some of that. But I know a lot of children and youth that I worked with were ultimately held accountable upon turning 18, when it was still, kind of a victimization they were experiencing. So I try to highlight that the awareness is the same, the vulnerabilities are the same, even though the criminal justice system may be handling it a little differently. Rejection by family is important, is a contributor as well, especially when you're talking about the LGBTQ plus community, community violence, of course, systemic issues, substance misuse, involvement with the criminal or juvenile justice system, immigration, limited employment opportunities, all can be risk factors and vulnerabilities. So let's talk about, I'm sure you all know that mental health providers are just so vital to a comprehensive service array for persons who have experienced trafficking, for persons who have experienced any form of trauma, abuse, exploitation, etc. But there are just known things. Person experiencing trafficking can experience trauma that results in mental health complications. Mental health professionals are a really important part of the identification and support efforts. Particularly important to be educated on trafficking for the purposes of identification, because a lot of folks may not self-identify as having experienced trafficking. They may not recognize their own victimization. They may not identify with being a victim. And so I think that's why identification efforts are particularly important. It could be because, if you're seeing awareness materials or media reports on what trafficking looks like, and it looks like nothing like your experience, that may make it difficult to self-identify. Or there's a whole array of reasons. Shame, something, in some cases it's because it just seems so normal to you and you don't know that what you're experiencing is actually problematic or a form of victimization. And so as folks who come across vulnerable populations all the time, identification, targeted efforts are really, really important. Persons who have experienced trafficking may not want help or see themselves as needing assistance. And so just having the ability to not only have identification efforts, but have those efforts be really trauma informed and understanding why they might not be identifying or wanting assistance at that time, being there through those stages of change, being there to meet folks at where they're identifying in terms of their victimization. Somebody does not need to identify as a victim in order to be able to, should not have to identify as a victim in order to be able to receive the help and support they need. And you all are just uniquely equipped to provide the short and long-term trauma-informed care that can really meet the holistic needs of persons who have experienced trafficking, that it can address their history of trauma, that can help get access to things that would reduce vulnerabilities through partnerships with other organizations that may provide things like stable employment, access to housing, some of those connecting devices that case managers and advocates are constantly working to ensure are there so that folks can have their other needs addressed as well. We do know also that there is a limited existing research regarding evidence-based intervention and promising practices in addressing the mental and behavioral health needs of folks who have experienced trafficking. There's some evidence based around trauma-focused cognitive behavioral therapy, EMDR, and a handful of other therapeutic modalities. But there's a continuous need to build on existing research to really understand what evidence-based interventions work, which subsections of the population they tend to work with, et cetera. So getting folks engaged and building on that research around mental health support for trafficking is something we'll be continuously kind of needing to do. So what can we do? I always like to leave folks with a set of action steps. So screening, as has been mentioned, and identification efforts can be a really key part of actions that can be taken, whether you are in private practice, whether you're within an agency, kind of regardless of what area of or type of agency you're working in, screening can be incorporated. And so I have pictured here a list of validated screening tools that is included in the National Advisory Committee on the Sex Trafficking of Children and Youth in the United States. It's their recommendations for states report, and there's a link to that report in the resources page, but also at the bottom of this slide. And so it's a really interesting full report, but this is a list of validated tools. Really important, of course, to recognize the age and environment in which they were validated for, but there's existing resources out there. Some of them are less than 5 questions, like the quick youth indicators for trafficking, that can pretty quickly and easily be incorporated into a standard set of intake questions. One thing I really like to highlight here is that also further educating ourselves on trafficking so that we can recognize within narratives that client narratives, what might be exploitation, what might be vulnerability, not relying on always having to say, okay, this is absolutely trafficking. But as our clients are talking to us and sharing with us, recognizing what aspects of those stories are vulnerabilities or increasing risk. How can we provide psychoeducation around that? What aspects are actual trafficking or potential exploitation, and how do we address that? So being really educated to recognize some of those things when listening to client narratives. And then I always to encourage trying to move from some of those very targeted questions that you may see in some of these screening tools, like have you exchanged food for shelter? Some of those really kind of targeted questions you'll see getting to sex trafficking victimization, to broader things like how have you been caring for yourself when you needed somewhere to stay? Something that gets a little bit into a broader question around risk and vulnerabilities, and also equips us with takes us beyond a yes or no question and allows an opportunity for somebody to share how they've been caring for themselves. So you may hear trafficking victimization in that response, or you may hear other vulnerabilities that could be addressed for their care. All right, so what do we do when human trafficking is disclosed disclosed or suspected. So I came from the world most recently, child welfare. I still work a lot with child welfare agencies. So I'm going to spend a little time on this because I think it's important to talk about mandatory reporting and why mandatory reporting can look a little bit different with this. I know everybody's representing different states, so it is really important that you understand what the definitions are around child abuse and neglect in your state. Does it include labor trafficking and sex trafficking? What is the age of a child per the definition of your state? There's two different laws addressing child welfare's approach to trafficking that allow for states to define a child up to age 23 or up to age 26 for different reasons. And so it's important to know how a child is defined in your state and whether your state child welfare agency takes cases involving caregivers only or caregivers and non-caregivers. And so for the purposes of trying to make mandatory reports, there's a little bit of legwork that has to be done to understand how your state addresses it. But if the person as a child is defined for your state, of course, assess and address immediate safety needs, and then report those cases to your child welfare agencies per your state's mandatory reporting requirements. If the person is not a child under the definition of your state, still assessing and addressing immediate needs. And then there's options, but make sure that they are person-centered, kind of empowering options. Is that person experienced trafficking ready to report on their trafficking experience? If they're not ready to report and it's a situation where you can meet them where they're at in that, then support them, address any needs they might have, try to help put a safety plan together maybe with them, depending on what type of role you're serving in, and offer resources, education, and support to the extent possible. If they are, then there's a few different options. Of course, you can report to local law enforcement, the National Human Trafficking Hotline number here. In some cases, there's community or state hotlines or local hotlines. And so if there is in your area, that can also be called as well. But the National Human Trafficking Hotline is always a go-to resource that can be called. They have, if it's a suspected case of trafficking, they have contacts that they can refer it to in your area. And they also could help provide some resources to support that person. So just want to quickly touch on why one of the reasons I find it important to talk about mandatory reporting. In 2015, the Justice for Victims of Trafficking Act added sex trafficking into the definition of child abuse and neglect within the Federal Child Abuse Prevention and Treatment Act. Just last year, in January of last year, the Trafficking Victims Protection Reauthorization Act of 2022 added labor trafficking to the definition of child abuse and neglect. And so states are working on implementing that aspect. Some already have labor trafficking within that definition. Some are working to try to, during this legislative session, put that definition into the definition of child abuse and neglect in their state. So, it is the intention at the federal level that states look at both the forms of trafficking as a form of child abuse and neglect, and their definition goes by the Trafficking Victims Protection Act. So the intention is also that it includes caregiver and non-caregiver cases, which for folks that work with children, that is typically non-caregiver cases are typically out of the scope of child welfare or out of the jurisdiction of child welfare. So this is a unique one, in which case the relationship of the perpetrator to the child or the alleged perpetrator to the child, it can be reported regardless of that relationship. And in some cases, it can be reported even if there is no identified perpetrator. And so trafficking has changed the way things look. So it's really important to go into some additional detail around these conversations, I think, because it is so different than kind of your typical child abuse reports. And again, big recognition to our school-based folks. Schools tend to be a huge reporter and recognizer of child abuse and neglect. So thank you for the good work you're doing. And there's definitely more conversation we can go into if you need some clarification around that in the Q&A. So I wanted to quickly highlight, because I think it's exciting and important, a project that was done in the Southeast region. The RAISE project was done in a handful of regions, but I'm going to highlight the one that was done in the Southeast region, because out of that project came a work plan. So the RAISE project was funding that came through SAMHSA to support efforts to integrate initiatives addressing human trafficking, mental health and behavioral health, and substance use disorder. And so the mental health TTC, the substance abuse TTC in the Southeast, and Administration for Children and Families, SAMHSA, all joined together to create this work plan to try to understand what it would look like to really comprehensively integrate state legislation, policy, service provision, and other, prevention and training strategies and initiative to address mental and behavioral health, substance use disorder, and human trafficking. We know that there's so much intersection here. And so wanted to highlight that exciting project, and I'm excited, or I'm happy to share out the full work plan for anybody interested. But these were the three goals that the other kind of strategies came down from. So increasing human trafficking knowledge and practice within programs addressing substance use and disorder and mental health, behavioral health. Vice versa, increasing mental and behavioral health and substance use disorder knowledge and practice within programs addressing trafficking. And then, of course, ensuring that all of these approaches meet the needs of all persons. So it was a great project. The work plan action steps and recommendations that were developed through key partners in the Southeast region fell under prevention training. A lot of the training was cross-training opportunities, making sure mental and behavioral health professionals were providing trafficking providers with the training they might need to understand how to access care for their clients, or how to identify needs in their clients. And then prevention, of course, collaboration and partnerships, working together to expand the service array available, and getting more streamlined access to care, and quality of care, and enhancing quality of care for vulnerable populations. All right. So I wanted to make sure we saved some time for Q&A, because I know that was kind of a lot of information. And so I wanted to make sure that we had an opportunity to dive into any more of it if you had some questions, or if there's something that wasn't touched on related to trafficking that you have a question on. I am happy to try to answer some of those questions as well. I see that we have in the Q&A section some questions going. Please feel free to populate the Q&A place. Somebody will also be monitoring the chat if questions are coming through there. So I see the question from Maureen: will the slides be available as part of the recording? I will let the TTC folks answer that one. I assume so, but I am happy to share them. Is there a cost on the screening human trafficking tools? That's a great question. There are different screening tools have different costs. Most of them are free. The trafficking victim identification tool, the human trafficking screening tool, the quick youth identification tool. I think all but one on that list actually are free. The commercial sexual exploitation identification tool, so it's a sex trafficking specific identification tool for youth. There is a cost to using that one and to receiving training on it. But most of the other ones are free. You can quickly find them in a Google search, or I'll provide my contact information. I'm happy to share some of those. Great question. Does the media depict a wrong interpretation of sex trafficking, or is it along the lines? The depictions of trafficking, they in the media are real. They can be real depictions of actual trafficking. What tends to happen is that the most sensationalized versions or stories, or the most let's say the most, I don't want to say relatable victim, are the ones that tend to get the most attention. And so most often you're seeing sex trafficking being represented in media depictions. Most often you're seeing small children, or really heinous kidnapping and this kind of situations being represented in the media. So it is a very skewed depiction of trafficking because it tends to be the most sensationalized stories. And a lot of times, and when you see movies like Taken or Sound of Freedom as a more recent example, there is things being added on to those stories. Taken is obviously not a true story, but Sound of Freedom is based on a true story. And even in the media cases, you're seeing a lot of things added on to stories that sensationalize it even more. I would be really cautious around just kind of taking media depictions as your go-to to understand trafficking. Look for trafficking awareness, things from reputable organizations. I always say, if a survivor's story is being highlighted, or you hear a survivor speaking somewhere, or you're asking a survivor to speak somewhere, don't ask them to add any more onto their story. Let's honor their story. Let's honor their experience. It was traumatic. We don't need them to add on trauma just for the sake of us feeling like it's a better story or a more compelling story, etc. And so it's depicting, it may be depicting an actual trafficking case, but the stories that tend to be picked up tend to be the more sensational, or sensational per whatever kind of narrative they're trying to feed, or get folks to click on type of thing. So hopefully that answers your question. I have some resources at the end that are great training resources to dig a little further into this that aren't sensationalizing it. What is the best resources for bringing initial awareness of this topics to schools? Great question, Maureen. There have been some resources. There was a grant specific to prevention in schools of trafficking. And so out of that came some resources. There's a toolkit called the Human Trafficking, it's all the letters, HTSSP, Human Trafficking School Safety Protocol, that came out of that, which is actually linked in the resources that helps school in developing a protocol around addressing trafficking and also educating students on trafficking. There is also a lot of educational resources that came through that I'm happy to share with you, that were developed for both teachers and students. There's curriculums like Love 146, Not a Number, and many others. I don't mean to highlight just one, but that's a great one, that are being used in schools for awareness for youth. And then a lot of kind of other resources have been developed through that prevention education grant. And so I'm happy to share some of those with you to kind of follow up on whether you mean for students or for teachers. Oh, to our educators, it says that. I should just read the rest of the question. Yes, to our educators. Yeah, we can look through some of those resources through the National Human Trafficking Technical Training and Technical Assistance Center. There's lots of free trainings on there that are great for folks working in different sectors. Yeah, I'll make sure my email address is at the end. In fact, I'll just go ahead and put my email address up because you all don't need to just look at question marks. Here's some of the resources that I have talked about. There is the SOAR online trainings through NITAC, the National Human Trafficking Training and Technical Assistance Center. There is a handful of them. They're all free. There's trauma-informed approach training specific to trafficking. There is a linguistically appropriate services, culture and linguistically appropriate services, pre-training specific to trafficking, trainings for different sectors. So go through and look through there. There's a lot of great resources in there. There is, of course, the Polaris Project, a lot of extra resources there. The toolkit for building human trafficking school safety planning information, lots of different resources in here. I could have filled probably 3 slides, but tried to give a helpful start of some information. here's my email address too, if you want to follow up asking about specific additional resources. I have done work with some schools and of course other child serving agency types. But they also have access to information. I work with OVC grantees who are working with Office of Victims of Crime grantees who are working with various ages and trafficking types. And so lots of resources out there available through the Department of Justice and through the Administration for Children and Families and HHS. I also meant to highlight too, to just give a shout out to SAMHSA. They've hired a person within, and I'm gonna look at my notes to make sure I get the name right, but they have hired a person within their mental health services division who is specific. Their specific role is looking at human trafficking from the mental health perspective. So there's been some great work being done at the federal level that will hopefully generate extra energy trickling down. We'll see some additional resources, research coming out of that. Some organizations recommend universal education versus screening. Absolutely. I think universal education is a great way to go, especially in medical clinics and in places where you might be experiencing screening fatigue. Absolutely. That's a great point. There are loads of documentaries of varying cost and some free, of course. Diana, if you'd like to follow up with me via email, I will help connect you with some of those. Let's see, how could I go about incorporating into our work resources for help for individuals to have at their own leisure? There are some free resources that come through the Blue campaign and some other campaigns. Look beneath the surface that are brochures. I don't know, some of you may have seen in Florida, where I still currently live, there's rules that awareness signs have to go up along the turnpike. They have to go up in other rest areas and stuff across the state. So you'll see examples in some places where there are awareness signs. Those are all free materials that I can give you the links to how to access those. But there's a few different campaigns that come in multiple languages that can be left somewhere like a bathroom. There's labor trafficking and sex trafficking related ones. They often have the National Human Trafficking Hotline number on them, and they're free, and you can order a stack of them to be placed wherever you'd like. So the resources, they often include kind of risk factors and indicators as well as ways to get help. So there's those national resources, and there may also be, if you have an anti-trafficking org in your community, there may also be local resources that can be handed out or used by your agency to help provide awareness to individuals that you're serving that have a little bit more of a local resources attached to them. So I would look for that too. There's a lot of task forces and human trafficking coalitions. There's grant funding that has also gone down to support task forces and coalition. So looking for those in your community, if there's a task force or coalition, trying to get engaged with them to either become a part of kind of the service array that may be supported through a task force or coalition, but also to understand if there's any resources or materials available, trainers that can help come further train staff. That is something I would look for in your community to try to learn more and to obtain resources. The free resources, if the questions on this will be on whose website. If you look up Blue Campaign, then you will pretty quickly be taken to some of those free resources. The Department of Justice Office for Victims of Crime that I mentioned earlier, and the National Human Trafficking Training and Technical Assistance Center. Both of those have some resources available for free related to trafficking. I'm not seeing any, I want to make sure I answered all the things in the Q&A. I'm not seeing additional questions in the Q&A. We want to make sure that we have time to talk about the survey, but would love, there's a couple more minutes if anybody has any additional questions. I will come back on camera because of course he's peacefully sleeping now. Happy to answer any more questions in the chat or in the Q&A. Also, as you see here, you have my email address here. I also help chair the National Child Welfare Anti-Trafficking Collaborative. So if you have any child welfare questions or need a connection to a child welfare person in your state, we have close to 30 states represented on that collaborative. So you can reach out to me with questions about that group as well. And thank you for helping, for appreciating the balance and for your patience and flexibility here with all the things that going into having a 3-month-old in arms.
All right, thank you so much, Bethany, for your presentation and for answering everyone's questions. The Southeast MHTTC would like to thank everyone for your participation in today's webinar. We value your feedback and invite you to evaluate our event. Please complete a brief SAMHSA required survey by visiting the link that Stephanie just dropped into the chat. Completion of this survey will provide information to SAMHSA and assist us in planning future events like this one. Afterwards, you will automatically be redirected to additional questions from us, the Southeast MHTTC, regarding the impact of this event on your knowledge and skills. After you fill that out, you will have the opportunity to download your certificate of attendance if you need that for your records. Just please allow about 5 to 10 seconds for your browser to redirect you to those questions. Again, our center appreciates your participation, your feedback. We hope that you'll all join us for future events. Please visit our website to learn more. And Bethany, we would like to thank you for such an amazing presentation and for answering everyone's questions. That is going to wrap up today's webinar event. Thanks so much.